Back pain and aging, is it inevitable? Namaste and welcome back to the channel. Another episode and another question that affects billions of people. I am Dr. Vardhan, your host and dost and India's #1 Ayurveda spine specialist. Today, I am answering a question that I often get from patients. Doctor, I am getting older, so is back pain just inevitable? Let me tell you this upfront. Aging is natural, pain is not. There is a difference between wear and tear and neglect and imbalance. In this video, I'll walk you through why back pain becomes more common with age, what actually happening in the spine, how Ayurveda explains this process, and most importantly, how to prevent or manage age-related back pain without surgery or long-term medications. Before getting into it, I would like to say something important to you all. Your family's health is priceless. If this video can ease someone's pain, a parent, sibling or friend, don't keep it to yourself. Share this video with love and subscribe to our channel for more trusted spine care guidance. Let's get into it. As we age, certain changes naturally happen in the body. The spinal discs lose water content and becomes thinner. The muscles supporting the spine can weaken. The joints in the spine, especially the facet joints, may develop mild arthritis. And over time, posture may shift, adding pressure to nerves and ligaments. All of this sounds bad, but here's the truth. Not everyone gets pain. Why? Because pain depends more on inflammation, mobility, lifestyle and dosha balance than just age alone. Age-related disc thinning is normal. Mild stiffness in the morning, also normal. But chronic lower back pain, sciatica and nerve compression, believe me, those are not inevitable. They usually result from sedentary lifestyle, untreated vata imbalance, poor posture, chronic inflammation, lack of spinal care. So instead of fearing age, we need to learn how to age wisely. In Ayurveda, age is considered a vata dominant phase of life. Vata governs movement, nerves dryness, and degeneration. When vata becomes imbalanced, especially in the spine, we see joint degeneration, muscle wasting, disc drying, anxiety and insomnia, that is sleeplessness. That's why most age-related spine issues, spondylosis, sciatica, disc bulge are vata disorders. But Ayurveda doesn't treat aging as a disease. It gives us tools to slow it down and stay mobile and pain-free well into old age. Now let's look at what typically starts showing up in the spine after 40 years. Cervical spondylosis, symptoms are neck pain and dizziness. Lumbar disc degeneration, symptoms are low back pain and leg pain. Facet joint arthritis, symptoms are stiffness and inflammation. Spinal stenosis, the symptoms narrowing of the spinal canal, and osteoporosis related to compression fractures. But again, these don't happen because you turned 50. They happen when the spine is ignored. So if you are over 40, these daily habits would be your best insurance. Do a light warm up every morning. Apply sesame warm oil to the lower back 2 to 3 times a week. Sit upright with lumbar support. Walk for 20 to 30 minutes daily. Avoid cold, dry and leftover food. Follow a stable sleep routine. These small adjustments reduce stiffness, improve energy and keep your back flexible. At the same time, nutrition plays a key role in spine health as we age. So do not forget to focus on warm, easy to digest meals, ghee, soaked almonds and sesame seeds, bone broth are Ayurvedic decoctions, anti-inflammatory herbs like ashwagandha, rasna, shellaki and dry ginger. And at the same time, try your best to avoid the following: excessive tea or coffee, cold water, white sugar, and late night snacking. Remember, food is not just fuel, it's therapy. However, if your pain is persistent, radiating to arms or legs, causing numbness, interrupting your sleep, or worsening with movement, then it's time to get it properly evaluated. But always say no to self-medication with painkillers, long-term bed rest, and believing pain is just part of aging. Early action means early and easier recovery. At Vardhan Ayurveda, we use specific Ayurvedic therapies to counteract age-related spinal changes. Some of them are Abhyanga, which is warm oil massage to nourish and loosen muscles; Kativasti, herbal oil pooling over the spine to relieve compression; Physichill, it is a full body oil therapy to calm the nervous system; Vasti therapy, medicated enemas for deep vata regulation; Nasya, nasal oil drops to improve nerve function; Rasayanas like Ashwagandha, Guggulu and Bala for bone and tissue strength. These treatments don't just relieve pain, they promote regeneration and balance. Aging is a fact, but suffering doesn't have to be. Back pain may be common as we grow older, but it is not inevitable. With the right lifestyle, the right therapies, and the Ayurvedic understanding of Vata and spine health, you can stay active, independent, and pain-free for decades. At Vardhan Ayurveda, we have helped thousands of people in their 40s, 60s, and even 80s live pain-free life without surgery and without any long-term medication. Thank you for watching. If you found this video helpful, subscribe to the channel. Here we provide practical advice rooted in traditional wisdom and backed by real clinical results. And don't forget to hit that bell icon so you get notified when we release our next video. Stay safe, stay strong, and take care of your spine at every age.